New videos every day.
Hi everybody, welcome back. This is a part 2 of subluxation degeneration. In part 1 we talked a little bit about symptoms and how they're really not a very good indicator of a problem. We mentioned that symptoms are just a warning sign. They're not the problem themselves, and that often just trying to medicate a symptom away can often be maybe not the best solution, right? And as chiropractors, we really strive to find the cause of these problems and then eliminate them. Now we're going to go on to discuss what a vertebral subluxation is, which we've done that on the first video. And we decided that a subluxation was something a little bit less than a complete dislocation of a joint, and it had nervous system interference. We also found out that the nervous system controls basically everything. So there's a whole host of different symptoms that can arise from spinal problems. But now I want to talk a little bit more about some of the specific things that can happen when you have a subluxation. There's actually 5 different things. So, Karina, if you wouldn't mind, go ahead and just read this first paragraph here.
Abnormal motion or position of spinal bones. The bones of the spine have lost their normal motion and position. This can restrict your ability to turn and bend. It sets in motion the other 4 components.
Yeah, so what does that mean to you?
That one of the components of a subluxation is either limited motion, or the motion is not the full motion that you're supposed to normally have. Yeah,
exactly. And that's one of the things that when we examine somebody, we're going to be looking for. We're going to make sure that they are able to move and bend and turn fully. Oftentimes, when somebody has a subluxation, that's one of the very first things that happens, is they're starting to become limited in their ability to move and bend and turn. Okay. So we'll find that. And then once we have that, we know that it actually starts setting them up for the following 4 things that are going to happen. So would you go ahead and read the next one?
Abnormal nervous system function. Improper spinal function can choke, stretch, or irritate delicate nerve tissue. The resulting nervous system dysfunction can cause symptoms elsewhere in the body.
Good. And what did you get out of that one?
So kind of like we discussed in the last video, that even a subluxation in your spine could actually affect your stomach, or even your eyes, or your colon, or any of your different organ systems. Yes,
exactly. And when we talk about symptoms elsewhere in the body, we're talking about somewhere other than your spine. So people that would get numb hands or tingling in their arms, or like we talked about, different organs malfunctioning, that's somewhere else in the body. And that's one of the things that happens when we have a subluxation. Good. Go ahead and read the next one.
Abnormal muscle function. Muscles supporting the spine can weaken, atrophy, or become tight and go into spasm. The resulting scar tissue can change muscle tone, requiring repeated spinal adjustments.
Good. And what do you think about that one?
I've definitely heard of, people having a muscle spasm or having a twitch or something like that. So I guess this is just saying that a subluxation can actually cause those muscles to become tight or weaken altogether, or have those different spasms.
Yeah, exactly. Because when that nerve is irritated, that nerve is going to become very excited, and it's going to start to fire with electricity. Yeah, because that's what muscles work on. And then when those fire, what are the muscles going to do?
Tighten up.
They're going to tighten up. So the person will go and get a massage, and it'll feel really good. It may even be very helpful. But if they're having a pinched nerve there, what do you think is going to happen to the muscles?
They're just going to be.
They're going to just come back and be tight again. And we hear that over and over again. Good. That's great. So tell me about the next one.
Abnormal soft tissue function. A rise in temperature from an increase in blood or lymph supply can result in swelling and inflammation. Discs can bulge, herniate, tear, or degenerate. Other soft tissues may suffer permanent damage.
Great. And what do you get out of that one?
Lucky enough, I've never had a herniated disc or a bulging disc, but I've definitely heard of people that had herniated or bulging discs. I know it causes a lot of pain.
Very painful. A lot of times people will come in to my office and they'll be being carried or they'll be bent way over. It's a very painful thing. And herniated discs can be caused by subluxation. Walking around on that vertebra out of place for a long time can cause those discs to wear and eventually rupture. So when we're talking about about a disc, we're talking about this space right here between the vertebra. When the vertebra is out of position or subluxated and the person walks around on it over time, this disc will actually wear out and it can herniate, put pressure on these nerves, cause a whole host of different problems. During the examination process, when we go down through the spine, we'll just touch the vertebra. And if there's swelling and inflammation in there, the person will go, oh, that's tender. Mm-hmm. I didn't even know that it was tender. They have no idea. Mm-hmm. They go, it didn't hurt till you touched it. But that's a sign of swelling and inflammation in there. Normally, it shouldn't be tender just to touch the spine. Right. But when there's swelling and inflammation due to subluxation, that's one of the ways that we can find out about that. Okay. Great. Would you mind reading the last one for me?
Abnormal function of the spine and body. Bone spurs and other abnormal bony growths attempt to fuse malfunctioning spinal joints. This spinal decay, scar tissue, and long-term nerve dysfunction can cause other systems of the body to fail. Yikes.
That doesn't sound too good, does it?
No, it doesn't.
So what do you get out of that?
That over time you could actually have growths of bone develop on your spine that would cause decay, scar tissue, and can cause other systems of the body to fail. So your other organ systems would actually fail as a result of the subluxation in your spine?
Yes, that's exactly right. And I want to show you with these models what that bony growth looks like. We'll take a normal spine here and one that's been subluxated here. Look along this ridge here and then look along this ridge here and tell me what the difference is.
This normal one is a lot smoother. Mm-hmm. It's just, and this one looks like it's decayed. It looks like it's gotten chipped away. It's all ragged on the ends. And this one definitely looks like the healthier spine.
That's right. I want you to notice the space that's here in between these joints, mm-hmm. and then compare it to what's going on over here. What's different?
You can definitely see that on the subluxation spine, there's a lot less space. It's starting to crowd. It's starting to kind of disconfigure. But there's definitely like a clear amount of space in between the vertebrae on that spine.
Right, right. So when we read this, it talked about abnormal bony growths attempt to fuse malfunctioning joints together. So this is what an abnormal bony growth is. And let me show you how it does fuse it together. Take this vertebra here and hold it just like this, and I want you to gently move it back and forth and feel that normal motion that's there.
Yeah, it definitely just kind of rotates on there.
Exactly. Yeah, and that's what it should do. That's normal. Now let's take the subluxated spine and try gently to do the same thing.
It doesn't move at all.
It doesn't move at all. Now what do you think how would that correlate to how you could move?
Well, it would definitely probably limit your motion if your spine wasn't able to move the way that it's supposed to move. It seems like it would also cause a lot of pain. It would potentially be squishing these nerves or cutting off the nerve activity altogether.
Absolutely, absolutely. So it could definitely interfere with the nerves because that's part of what a subluxation does. The pain part, sometimes yes, sometimes no. It's very interesting. Some people go through this whole process with very little pain, or they just ignore it and kind of push it away and just think it's part of getting old. But it's not. This is actually part of the subluxation degeneration process. And people with 75-year-old spines can just look like this. And people with 35-year-old spines can look like this. Wow. So subluxations are not to be trifled with. They are to be located, corrected, so that they don't continue to go on and do this kind of damage. And this last part here is where the doctor of chiropractic would benefit from having an x-ray taken so that he can actually see how much degeneration has gone on in the spine. The length of care that the patient will need would be somewhat correspondent to how much degeneration was in the spine. So we're going to give Karina an adjustment here. This is called a flexion distraction adjustment here. And this is to help improve the joint function in the lower back. Now, this particular technique we're going to be using is very, very good for people who have herniated discs in their lower back due to long-standing subluxation. We've actually helped a lot of people prevent lower back surgery with this technique, and even those who've already had surgery, we've helped them to prevent another surgery from happening. This is a very easy and gentle technique. Patients usually really enjoy this, and it gives them quite a bit of relief. And we're just gently distracting and tractioning that spine, helping to pull those discs back into the correct alignment along with the spine itself. Very gentle technique. Usually there's not a lot of popping that goes on with this particular technique. And there we go. So I hope this has been helpful. I'm giving you a lot of information today. Take it, utilize it, make it your own. Get healthy with it. Share it with others. If you need any more information, please don't hesitate to visit my website, jeffells.com. Thanks.